Senator Ted Cruz spoke with people at this town hall meeting tonight in Northwest Austin about veterans' health care. It's one of a number of appearances he's making across Texas. There were protests outside the Arboretum event, the majority of them upset at Republican plans to change the Affordable Health Care Act. Senator Cruz has been opposed to the current Senate plan, saying it does not go far enough in cuts. He sat down tonight with KXAN political reporter Phil Prazen. He's live here with more. Phil?
Well, Robert, Senator Cruz is used to being the thorn in the side of the Republican establishment in Washington, D.C., but now his plan could make their dreams of repealing and replacing the Affordable Care Act a reality. Now, quickly, his plan requires each insurance company in a state to offer everything that is required by the Affordable Care Act, and then they can offer plans that don't cover everything, more scaled back. In his view, more specifically tailored to an individual's health care needs.
Doesn't take away any choices. The existing choices remain there, but it adds additional new choices, low-cost, affordable plans, because there are millions of people, millions of Texans, who can't afford health insurance right now, but they may well want it if it were cheaper, if it were more affordable. That's what I'm fighting to do. If we can adopt that, I believe this bill will pass, and I believe it'll make a real difference for families who are struggling.
I mean, can you convince the people that are worried about this that even if it's not covered, it will still, if it's not mandated, it will still be covered by an insurance provider out?
Conservatives would eliminate the Title I mandates altogether. We don't have the votes to do that. Moderates, many moderates want to maintain those mandates. What the Consumer Freedom Act does is it keeps the mandates. It says that in any given state there will be policies that meet all the mandates, that have all the bells and whistles, that have the full Cadillac plans.
And it's up to me to know what is provided.
I think at the end of the day, you know more about your health care needs. I trust you to choose. I trust you to have, with freedom, I trust you to care about your family's needs more than anybody in Washington.
Now, there are two major hurdles for Senator Cruz's plans coming up. Now, the first one is a political one. The Congressional Budget Office could give it a score as bad as the House of Representatives health care plan and sour public opinion like it did that one. And then the second is a procedural one. The Senate parliamentarian could decide that it needs 60 votes instead of a simple majority to pass, and there are 52 Republicans. Live in Austin, Phil Prazen, KXAN News.
And for another perspective on Cruz's plan, we reached out to the Center for Public Policy Priorities. Stacy Pogue is a senior policy analyst there. She says Senator Cruz's proposal to turn current Obamacare mandated plans into a high-risk pool would create affordable health care for people with low incomes because taxpayers would help pay for it. But she warns middle-income earners in need of medical care, people with cancer, chronic disease, and pregnant women would have two options: pay high premiums without taxpayer help in the high-risk pool, or pay for plans on the private market that might not cover everything, like before Obamacare.
An individual making under $42,000 a year, you could help in the high-risk pool. But everybody else would be on their own, and because premiums would be so high, a lot of people would be locked out, effectively locked out. And the people who'd be locked out are the people who need health care the most.
And to combat that, Senator Cruz told Phil they're setting aside more than $100 billion to stabilize the program and help the people caught in that gap. Congressmen and senators return to Washington next week, and look for more on the new health care reforms on State of Texas In Depth this Sunday morning. It's before Meet the Press.